Okay, thank you for this information. So we proceed with the next presentation given by Dr. Aswin from Mulawarman University in Indonesia. And she will present a very interesting case, testicular torsion in children with positive cremasteric reflex. Please.
Thank you. I'm sorry I cannot share screen because the previous speaker still shared the screen. Thank you.
Sorry.
Yes. Thank you, Professor Hentschel, for the introduction. So my name is Amalia Aswin. I'm a clinical medical student from Faculty of Medicine, Mulawarman University, specifically at Samarinda, Indonesia. Now, I'm a member of European Society for Pediatric Research, and now I'm presenting on behalf of my colleagues, Nurliyana, Aris, Indrawan, and Aditya Rahman, and also my teacher, Dr. Boyke Soebhali. So I will present about testicular torsion in children with positive cremasteric reflex. So as we know that testicular torsion is a twisting of the spermatic cord and its contents. So it is the most common cause of scrotal pain in children, and it is considered a surgical emergency because the delay of diagnosis and treatment will lead to blockage of testicular blood flow and will lead to irreversible testicular damage. The incident itself is 1 in 4,000 male before age 25, and it can actually occur at many ages, but most commonly at age 12 until 16 years old. So the cremasteric reflex has been reported to be absent in 100% case of testicular torsion. So this is why that in the emergency department that the clinicians still use this test to rule out the diagnosis of testicular torsion because the positive sign of testicular torsion, the positive sign of cremasteric reflex is lead to non-testicular torsion. So it is still a big question for us because not all of patients with testicular torsion were found cremasteric reflex negative. So as we seen in the patient, it is a 13-year-old boy from Indonesia. He was admitted to the emergency department with acute pain on the scrotum. He was sleeping at home and then he woke up at midnight because of the intense pain of the scrotum. And the symptoms start 6 hours before he arrived at the hospital. And the pain was described by this patient was sharp and severely itching without any radiation. The patient also had nausea and vomiting. There was no history of trauma over the scrotum and inguinal region. And there was no history of urinary tract infection. So the physical examination, the vital sign of the patient, the temperature, heart rate, blood pressure, and respiratory rate were found in normal range. On the scrotum examination, his right side were in normal findings, but otherwise, his left side of the scrotum showed elevated left testis and pressure pain. There was no sign of inflammation, and the French sign was negative, and the cremasteric reflex was found positive. There was no abnormal discharge to the urethra. So this is the physical examination of cremasteric reflex that we perform on the patient. So we perform lightly stroking on the superior medial or inner thigh of the patient where there was seen a response of contraction of the cremasteric muscle that pull up the testis ipsilaterally. Yes, as you can see in the video. So the mother of the patient was explained about the condition and the informed consent was obtained for the removal of the left testis. The patient was well during his post-operative period. So this is the surgery that we perform. We perform exploratory surgery. So the left spermatic cord torsion was confirmed in the surgery. We've already waited and done everything to see if the left testis is still viable or not. But unfortunately, due to non-viability, we need to do orchidectomy to the left testis. Orchidopexy was performed on the right side of the testis and was found pink and viable. So in the discussion, testicular torsion is an emergency case, especially in pediatric surgery, department, which account for 5 until 25% of acute scrotum in children. And the classical clinical manifestation of testicular torsion is sudden onset of severe unilateral testicular pain with nausea and vomiting, hypoposition of the testis, and patient may also have other symptoms such as fever or urinary problems. So there are two important factors that determining testicular damage. First is the time from the onset of the symptom, and second is the degree of twisting in the cord. So what I want to underline is time is really important for the testicular torsion. So we can see that the physical examination plays an important role in the diagnosis of testicular torsion. So the pen test, our pen sign that also we perform in the scrotal examination. If it is negative, then testicular torsion is suspect. But if it is positive, it doesn't directly exclude it. So nowadays, the presence of cremasteric reflex is the most valuable clinical finding for ruling out the testicular torsion, while the absence of it is indicative for testicular torsion. So the absence of the cremasteric reflex is indicative for testicular torsion, especially in pediatric population from age 30 months until 12 years. However, contradicting the theory, the patient that we had in here present with a positive cremasteric reflex and was confirmed as testicular torsion in the operating room. So if we see the examination that we rely so much at, the actual sensitivity of cremasteric reflex is 88.2% and specificity is 86.2%. So the cremasteric muscle and reflex are actually altered in curtain disease states, and the presence of it cannot exclude testicular torsion, because abnormal cremasteric muscle and reflex have been observed in boys with cryptorchidism, as well as myelomeningocele. Even among normal boys, the presence of cremasteric reflex is somewhat variable. So correct diagnosis is essential because the delay from the time when the symptom begin until surgical treatment is performed is directly related to the testicular recovery and salvage. So we cannot rule out the presence of testicular torsion just because there is a cremasteric reflex positive, because as what I said before, a misdiagnosis that leads to delay the treatment, we need to avoid it because it will be related with the percentage of testicular recovery and salvage. Thank you.
Okay, thank you, Dr. Aswin. I think this is a very interesting case and the message is very clear. Do not rely upon the cremasteric reflex. It might, even though if it is positive, be a testicular torsion. You looked at the textbooks, I think, and you found a universal example for positive cremasteric reflex, and the testicular torsion is excluded. Is it a problem that textbooks, they use the same text? One author writes the same as an author from another textbook, or what do you think is the reason that the textbooks are so misleading at this point?
Yes, as I seen in the many textbooks and journal, it is stated that if it is testicular torsion, they will find negative cremasteric reflex. But however, I found a couple of case reports that state cremasteric reflex that found positive in testicular torsion. So I think that the analysis of the research will lead to the conclusion of positive cremasteric, negative cremasteric reflect in the testicular torsion. However, not all of the cases of testicular torsion is actually negative cremasteric reflex. So I think that we actually cannot just take this is as a must or an obligation that in the testicular torsion, it should have a negative cremasteric reflex. So we need to take a consideration if we found a patient with positive and with a negative cremasteric reflex. I think so, Professor Hentschel.
And in this special case, what prompted the doctors to call the surgeon to have this patient operated? Was it the persistence of pain, or did you any other diagnostic? Did you use any other diagnostic tool, such as sonography or something like that?
Yes, eventually, we didn't perform any ultrasound or Doppler in the emergency department because our emergency department relies so much at the physical examination. But we see that the patient have what can I say, not normal pain that he had. So it is severe, severe, and severe each time. So we think that the positive cremasteric reflex is somehow not we cannot think that it is to rule out the diagnosis of testicular torsion. So it is already confirmed in the surgical procedure that we found the testicular is really had a torsion of spermatic cord.
Okay. Thank you for this explanation. And I think that the message is the gold standard nowadays is sonography. Do you agree?
Yes, I agree. Even in emergency department, we need to see the testicular blood flow, and it only can be seen in the ultrasound or Doppler to see if it is still viable or not, if there is a good testicular blood flow or not. I think this is a good to diagnose the testicular torsion itself.
Okay, thank you.